So I'll be doing the central venous access device dressing change. And what I'll start with is going into the patient's EMR and indicating the reason for the dressing change. And I see that it's going to be routine. So go ahead and gather my supplies. And because of COVID, we are going to be wearing our mask, of course, to start with. And I have my kit and my measuring tape. And I think I'm ready to go inside. So, hi, my name is Danielle Sapiens, and I'll be your student nurse for the day. Provide privacy. Do you mind telling me your name and date of birth, please? Jack Tracy, 11/21/1951. 51? You look so young for your age. Okay. So, Mr. Tracy, I'm here to do the dressing change, routine dressing change, as I said. Before we get started, I'd like to ask you, though, are you in any pain from a scale to 0 to 10? 0. Okay, great. So, I am going to get started by setting you up, raising the bed to a comfortable height. And I'm going to go ahead and put you in a laying position. Just let me know if you're not able to tolerate this, okay? All right. So I will lay the patient down to a supine position. Can you please look away that way? And I'm going to ask you to put a mask on just for some extra protection, okay? And I'll back off, wash my hands, and put on some gloves. Don gloves. So the first thing I would like to do, because it's a see-through dressing, I'm going to go ahead and measure. And I remember looking in the documentary before coming in that it was about 19 centimeters. So I'm going to go ahead and just put it along. And it is 19 centimeters. Okay, good. So it looks like nothing has moved. And so I'm going to carefully remove the dressing towards the biopatch. Being very extra careful not to tug on the line or, have it dislodge. Very sticky. Oh, and you know what? And I'm just gonna kind of palpate around the site, and I'm kind of looking for any redness, any tenderness while I'm doing the procedure that shows any sign of infection. Okay, and I be very careful once I get to the biopatch. And I will remove. And then I'll just look at the site. Assess the site, making sure there's no redness. The sutures are looking good and healing great. So I'm going to discard this, and now I'll set up my sterile field. Okay, I'll kind of scoot this way where you guys can see him, but you can see my field. So I will open the dressing chain, and I already donned a mask, so I'm going to take off my sterile gloves and don my sterile and set up my sterile field. I want to stand so that way you guys can see it's below my waist, but I'm just kind of pretending at this height that it's below my waist, or it's above my waist, sorry. Okay, and then I'm just going to kind of dump my supplies. And just bear with me while I get set up really quick. I kind of like to just put it in an order. Okay, so I'm gonna start by getting my alcohol swab. Toss it away. Okay, and I'm just gonna clean in an outer motion for about 30 seconds. Okay, and discard. And we get the CHP. And again for 30 seconds. And an outward motion. If I had a bigger dummy, it'd be a little bit kind of more like this. Again, 30 seconds. Discard. And let it dry. Then I'm going to clean the line itself. Discard and just kind of let it dry, let air dry. And I will be getting this protective wipe. This is for the dressing. And then kind of put it on the outside where the dressing is going to kind of touch the barrier of the skin. I have this bio patch. Of course, I have my field and my peripheral right here. And we'll be setting the bio patch. And then a piece of tape. And set my line, secure it. Sticky. How are you doing, Mr. Tracy? And I will label my dressing with my initials, the time, and the date. Kind of press down and make sure that the dressing is covered, or the site is covered. Alright, that's a beautiful dressing, if I do say so myself. I'm kind of clean up around here. Alright, how was that, Mr. Tracy? Not too bad, right? Is there anything else I can get you before I leave? No? Okay. And are you in any pain on a scale from 0 to 10? 0? Alright. So if there's anything that you can't, that you will need while I'm out of the room, your call light is in reach. I'm going to go ahead and lower your bed. And I'm just going to kind of assess my site. You're looking good. Alright. And I will exit and document.